Well, Mark Janella at the top of the show mentioned the positive COVID-19 numbers in Ontario that are suggesting a downward trend. Premier Doug Ford said the province is headed in the right direction, but he can't say when he will open up the economy. His message? Hang in there.
It's the lowest amount of cases we've seen over the last 3 weeks. And this is a positive trend to give people hope that we're getting close to opening up. I can't give you dates right now, but what I can give you is hope that we're getting closer. Day after day, when we see positive trends going down.
So today we had 347 new cases. That's a 2.3% increase. That's good news. But the emphasis is on testing in long-term care. So we really aren't getting a true snapshot of what is actually happening in the broader community. One expert says we should be doing ongoing random cross-province testing before we think about easing restrictions.
We have no idea what's happening in the community. If it were up to me, I would do what's called a stratified random sample test, and I would do that every week in Ontario. By stratified, I mean you make sure that you have men and women and old people and young people and apartment dwellers and rural people. You do a cross-section of everybody, and you do every week. And then you'd really be able to see what the change is like. Is it ebbing? Is it increasing? To do it just once is going to give you a snapshot, but to do that on a weekly or even every other week would actually have given us a great sense of the progress of the virus. Ontario's testing approach has ensured that we stay as blind as possible.
Now here's the Associate Medical Officer of Health's response when I asked why we aren't doing random testing.
We seem to be targeting our testing, but it doesn't really give us the big picture.
That's an excellent question. And I think our public health measures group probably will be looking at that. One of the things that I know that the lab, Public Health Ontario lab and the national lab have been looking at serology tests, and serology being blood tests to look for antibodies. And there are some issues right now. They're looking at the validity, how much, false positives, false negatives, all this kind of thing. But if we can find a good serology test, that would be the best way, I think, to look at how many people actually have been exposed to this infection.
Now, antibody testing in New York City indicates 25% of the population has already been infected. We have no idea here what it might actually be in Ontario, how many have had COVID-19 but are asymptomatic, and no timeline for starting this. The epidemiologist I spoke with, Colin Furness, says herd immunity is believed to be around 70%.